Early May 2026, a rare hantavirus outbreak shocked the world as it affected a cruise ship carrying nearly 150 people traveling from Argentina. The MV Hondius, stationed off Cape Verde, became the center of international concern after several passengers fell ill, with a few confirmed deaths. Health personnel and PPE assisted patients onto boats, highlighting the seriousness of the situation. Countries quickly ordered tracking and self-isolation for those at risk, while the World Health Organization maintained that the risk of global spread was low. This scene sets the stage for our deep dive into the facts behind the outbreak and what experts say about its potential threat. Outbreak began with the death of a 70-year-old Dutch male, marking the index case. He started showing symptoms 5 days after departing Ushuaia, Argentina. The ship alerted the World Health Organization, and laboratory tests in South Africa confirmed hantavirus. As of May 8, there were at least 8 reported cases, with 3 deaths, including the wife of the first victim. 1 person remained in critical care. Passengers were hospitalized in South Africa, the Netherlands, Switzerland, Singapore, and Spain. International tracing efforts intensified as some passengers had already returned to their home countries, raising concerns about wider spread. Despite the alarming headlines, the World Health Organization declared the global risk of spread to be low, as the outbreak remained confined to a small group of travelers. The European Center for Disease Prevention and Control activated its early warning and response system to alert public health authorities across Europe. With coordinated efforts underway, the situation was closely monitored, and public health agencies worked to track exposed individuals. This scene emphasizes the importance of global collaboration and rapid response in containing infectious disease outbreaks. Hantavirus refers to a group of zoonotic viruses carried by rodents, which spread the virus through saliva, urine, or feces. The ANDV strain identified in this outbreak is unique because it can be transmitted from person to person, unlike most hantaviruses. For human-to-human transmission, close and prolonged physical contact is required. The virus is endemic in South America, maintaining a low-level presence. Hantaviruses are linked to severe disease and death, causing Hantavirus Cardiopulmonary Syndrome with a fatality rate as high as 50%. Understanding the virus's nature is crucial for assessing its threat. Experts explain that hantavirus lives in small rodents, often in dry climates. The virus is shed in their urine and feces, and people usually become infected when they stir up dried dust containing the virus, which is then inhaled. The ANDV strain, unlike others, can spread from person to person, but only through close and prolonged contact with infectious body fluids. Previous outbreaks have shown that direct physical contact and time spent in enclosed spaces are necessary for human transmission. This scene clarifies how the virus moves from rodents to humans and, in rare cases, between people. ANDV strain's ability to spread between humans is what makes this outbreak particularly concerning. Unlike other hantaviruses, which do not spread human to human, the ANDV strain requires close contact, such as direct physical interaction or exposure to body fluids. Experts stress that casual contact, like passing someone in a store, is not enough for transmission. This distinction is important for public understanding, as it means the risk to the general public is much lower than for diseases like COVID-19. Monitoring and isolation are key for those exposed. The cruise ship soon to dock in Spain, concerns about further transmission grew. However, experts remained cautiously optimistic. The outbreak appeared well confined, and passengers who had left the ship were being monitored by local public health personnel. Global health agencies coordinated medical evacuations and tracking of exposed individuals. Despite the high mortality rate, human-to-human spread is uncommon and requires close contact. At this time, the overall risk to the general public is considered low, and experts do not expect a COVID-like epidemic. Identifying hantavirus infections can be challenging. The initial phase often seems mild, with symptoms like fever, headache, feeling unwell, and muscle aches. These early signs may not alarm patients. The incubation period can last from a few days to 8 weeks, making detection difficult. After this phase, patients may suddenly become seriously ill, developing Hantavirus Cardiopulmonary Syndrome, which includes difficulty breathing, low blood pressure, and severe weakness. Understanding these symptoms is vital for early intervention and care. ANDV's hantavirus causes symptoms such as fever, muscle aches, back pain, abdominal pain, vomiting, and diarrhea. Severe cases progress to respiratory distress, pneumonia, and drops in blood pressure. Laboratory testing is required to confirm hantavirus as the cause. There are 2 main syndromes: Hantavirus Pulmonary Syndrome (HPS), which affects the lungs, and hemorrhagic fever with renal syndrome (HFRS), which affects the kidney. The ANDV strain is associated with lung symptoms including shortness of breath, fluid in the lungs, shock, and severe oxygen deprivation. Currently, there are no vaccines or antiviral treatments for hantavirus. Treatment is supportive care, often in intensive care units. Official guidelines recommend rodent-proofing homes by sealing holes and gaps, setting traps, and wearing personal protective gear. HEPA-filtered respirators N95 are advised when cleaning areas with rodents. Spaces should be well ventilated and disinfected after rodents are removed. Passengers exposed to the virus are encouraged to isolate at home for up to 6-8 weeks and monitor for symptoms, contacting public health authorities if needed. Isolation is crucial for those who may have been exposed to hantavirus. Experts recommend that everyone who disembarked from the cruise ship should isolate at home for 6-8 weeks to monitor for symptoms. If symptoms develop, immediate contact with public health authorities is necessary for testing and care. The general public is not at significant risk, as hantavirus requires close contact for transmission. This scene underscores the importance of following public health advice to prevent further spread. Identifying the origins of the hantavirus outbreak is less challenging than with SARS-CoV-2. Hantavirus is not new to humans, and exposure likely occurred from rodents to passengers before boarding the ship. Activities such as bird watching in areas with rodents may have contributed. The ANDV strain was first discovered in Argentina in 1995 and is most commonly found in Argentina and Chile. Public health investigations are ongoing, but initial cases are believed to be due to exposure to infected rodents in the region. This outbreak is a reminder of how interconnected the world is and the importance of global preparedness. The World Health Organization and other agencies play a vital role in epidemic response and monitoring. Scientists are working to identify the specific virus causing the outbreak, and public health authorities are investigating how it started. As more information emerges, recommendations may change and vigilance remains essential. This scene highlights the need for international cooperation and readiness in facing public health threats. Medical News Today spoke with three experts, William Schaffner, Justin Chan, and Monica Gandhi. Their insights helped clarify how the virus spreads, what symptoms to watch for, and how to protect oneself. They emphasized the importance of monitoring, isolation, and following public health guidelines. Their expertise reassures the public that while the outbreak is serious, the risk of a global epidemic remains low. This scene brings together expert perspectives to inform and guide viewers. Summary: the hantavirus outbreak on the MV Hondias cruise ship has raised global awareness but remains confined. The ANDV strain's unique ability to spread between humans requires close contact, making widespread transmission unlikely. Symptoms can be mild at first but may progress to severe illness. There are no vaccines, so prevention focuses on rodent proofing and isolation. Experts and public health agencies are actively monitoring the situation, and global preparedness is key. Stay informed, follow guidelines, and remember that the risk to the general public is currently low.